Hello, everyone, and welcome to our question lab this evening. This evening's topic is neurophysiology, and once again, we are lucky to have Paras Vacaria leading our dissection today. Paras, do you want to introduce yourself?
Yeah, thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri. Went back home to Michigan to do medical school and have been working with USMLE-Rx for over a year now as an RX coach. So working one-on-one with students in regards to preparing for the USMLE Step 1 and USMLE Step 2 CK. And I'm happy to lead tonight's session.
Excellent. Thank you, Paras, and we're happy to have you lead as well. We have some wonderful panelists joining us this evening. We have Jeff and Kate, who you'll meet later, and Alec, who you'll meet now. Alec, do you want to introduce yourself?
Hi, everyone. My name's Alec. I'm a fourth-year medical student at Cooper Medical School in Camden, New Jersey, and I'm going into orthopedics. I've been with RX for about 5 or 6 months now, and it's been great so far.
Excellent. Thank you, Alec. I know the volume there was a little low, but Alec is one of our RX coaches, and we're happy to have him here. If you look at the right side of your control panel, you will see a question box. In that question box, you're able to ask questions, and our panelists will do their very best to try to answer all of your questions this evening. My name is Sean. I've been with RX Coach for about 2 years. RX Coach is our tutoring and coaching program, which has had a lot of success recently, and we will talk more about that later. You have had a chance to meet us, and we would love the opportunity to meet you. So I'm going to ask you a question, and the question is simple. Who are you? Also, if this is your first time attending a question lab, please let us know in the question box. We'll give all of you a few seconds here to respond. As always, we encourage all of you to tell your peers about these question labs. We will be deciding on how frequently to do these labs based on attendance. And as you can see today, attendance is a little low. So we hope that you guys will help us and help us continue doing these labs for all of you. All right, a few more seconds here and then we'll get started. As always, please keep in mind that we do have a raffle and a very special offer for all of you in attendance. So make sure you stick around until the end because you must be present to win. Looks like we have a good amount of medical MD students from US and Canada. We also have a large international crowd with US and Canadian born IMGs, as well as international medical students and graduates, as well as some DO students. So welcome to everybody. And I hope that you will find today's session helpful. Another question for all of you we'd like to ask is, during the pandemic, how has your spending on medical school resources changed? Choices are, I've spent much more, I've spent a bit more, no change. I've been cutting back on my spending some, or I have been forced to cut back on my spending significantly. Please let us know. Keep in mind that all of these answers are completely anonymous. We'll give all of you a few seconds to respond, and then we will get started with our first question on neurophysiology. I see the responses coming in a little slowly. We'll give all of you some more time. Once again, please keep in mind that all of these responses are completely anonymous. All right, a few more seconds here. And let's see what you selected. Well, it looks like a pretty even split. 25% of you say no change, 25% of you say you've been cutting back, some say you've been forced to cut back, and there's some of you are saying you spent more and much more or a bit more. So it's a nice spread there, and thank you for your responses. As I mentioned earlier, RX Coach is our one-on-one coaching and tutoring program. I see some of our coaching students here today, so we want to welcome all of you as well. We'll talk more about our coaching program a little bit later, but what you should know now is that the methodology we are using this evening is the same methodology that we use as a part of RX Coach. So here is our first question of the evening. As you can see, the answer choices are covered up. and that is by design. The first step in our process is to cover up the answer choices, which is why I've removed them. And we do that because we do not want the answer choices to guide or dictate your thought process. And we certainly don't want you to see an answer choice that you're unfamiliar with, which can cause you to panic as you're trying to maximize your potential and points on test day. So once we cover that up, we will read the lead-in. The lead-in is the last sentence or the question itself. This patient's stroke most likely damaged which of the following brain structures? This patient's stroke most likely damaged which of the following brain structures? Now at this point, we like to ask our students what the keywords are in the lead-in. Your coach will ask you what the test writer is asking you and how many steps this question requires. The reason we do that is because we want you to have an organized thought process, to avoid making careless mistakes, and to also ensure that you're answering the right question. By doing this, you will also be able to save time and prevent yourself from having to reread the question so you can pick up on relevant clues the first time around. So I can see we have a lot of repeat attendees, and they're already starting to answer how many steps they think this question will require. I'll give all of you a few more seconds to type in the question box and let us know how many steps you think this will require, and then we will read the STEM together. All right, let's go ahead and read that question STEM. A physician conducts a bedside language examination on an 87-year-old woman who recently had a stroke. The patient's speech is fluent and demonstrates normal intonation and content. She can follow oral commands such as close your eyes and point to the door. However, when asked to repeat individual words or the phrase no ifs, ands, or buts, she is unable to comply. The patient's stroke most likely damaged which of the following brain structures? I will let all of you start thinking about what the most important clues are in that vignette as I hand it off to Paris.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in this vignette in the lead-in. So, they do tell us that this lady had a stroke, and demographics is always important. This question isn't so much getting at this, the fact that she had a stroke, but, where is the stroke happening? So they give us some important information. She's got fluent speech, normal content, and she can follow commands. She can't repeat certain things though. So these are all important clues that we're gonna have to try to corral into coming up with a brain structure. So getting to that lead-in, again, the highlighted things is what we think are important. So stroke damaged which brain structure? So I think in terms of how many steps we think this question is, I think, at first glance, it probably seems like a one-step question. We know she had a stroke, and then based off her signs and symptoms, where is this location of this the stroke? So I think you could argue it's just a one-step question. I think that one step requires a good amount of knowledge, to know the different areas of the brain and to be able to parse out where the stroke happened. So I think it's a one-step question, but a pretty dense one-step question. So that being said, let's take a look at those answer choices and see what we're working with here. So when we go through answer choices, we recommend that students start at the bottom and work their way up. So start at answer choice E and work your way back up to A. And if you're wondering why we do this, we recommend that because a lot of times students will start at the top and they'll see something they like and then they'll bias themselves and pick that without having read all the answer choices. So this way, it ensures that you get through all the answer choices and you're not biasing yourself. So we'll go ahead and do that now. Answer choice E, Wernicke area. D, medial longitudinal fasciculus. C, Broca area in the right hemisphere. B, Broca area in the left hemisphere. And A, arcuate fasciculus. So go ahead and start to think of what brain structure you think might be damaged. Select the answer you think is right, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. Yes, we'll give all of you a few seconds here to respond. And then we will go over the correct and incorrect answer choices. As always, keep in mind that we do have a raffle at the end of the night, and you must be present to win, so make sure you stick around. And we also have a special offer for all of you that Jeff will go over with you at the end. All right, I see the responses coming in. We'll give all of you a few more seconds here. It looks like there is a clear favorite. All right, and it looks like 42% of you selected arcuate fasciculus, and in second place was Broca area in the left hemisphere. With that, I will turn it over to Bara so you can explain to you why A, arcuate fasciculus, is in fact the correct answer and why the other answer choices are incorrect. Boris.
Thank you, Sean. Great job, guys. Definitely a tough question here. So let's go back to that vignette. So we know that this patient has normal fluent speech and normal comprehension because she can follow commands. She is comprehending the command and she is doing it. So that's comprehension. However, she's unable to repeat specific words or phrases, and that's characteristic of what we call conduction aphasia, okay? So if we move along to the next slide, and Sean has actually included a couple of nice photos here. So here's one, and you can see nicely how the arcuate fasciculus kind of connects the Wernicke area with the Broca's area. And keep in mind that, you know, a lot of times they'll ask you, they may not necessarily just say Broca's area or Wernicke area, but they'll ask you specifically what portion of the lobe is that? You know, what is that the superior gyrus of blank lobe, things like that. So keep this anatomic picture in mind. On the next slide, we have a table and actually a nice diagram that kind of highlights what you should be thinking. So if we look at that kind of that almost helpful diagram of sorts, we recall from our patient, she had fluent speech and good comprehension. So she would be on the top left side, and keep in mind also, if you see that diagonal axis that says poor repetition versus good repetition, she had poor repetition. So she would be to the up and to the left of that diagonal axis, and then she would fall in the conduction aphasia grid. So when you look at that table, you can then go and see conduction aphasia can be caused by damage to the arcuate fasciculus. So keep that in mind. This is a very helpful tool that can be very important, very helpful, you know, when you're trying to answer these board questions in a minute or less. So let's talk about the other lesions, and we'll kind of stay, or other answer choices, but we'll kind of stay here on this picture so you can see why the other answer choices were incorrect. So Wernicke's area, Wernicke's aphasia, as you can see there, would be characterized by fluent speech as well, but poor comprehension. So that would be the main difference there. Poor comprehensive of language, and on top of that would also have poor repetition. So hopefully you can see on that box, that square diagram, where that Wernicke's falls in. This patient, as we said, had intact comprehension, so that would not be Wernicke's aphasia. Answer choice D was medial longitudinal fasciculus. This is kind of a little bit of a red herring. This has more to do with the oculomotor nucleus and its coordination of conjugate gaze, so more of a vision issue in patients who have, let's say, multiple sclerosis. Answer choice C and B, we're getting at Broca areas in the left and right hemisphere. The right hemisphere is usually in most people the non-dominant hemisphere. So if you have a lesion in the non-dominant Broca's area, that would generate what's called motor aprosity, which is where patients have difficulty expressing emotion. So they have a flat tone, a flat affect, not what's going on here. A lesion in the dominant hemisphere of Broca's area, which is usually the left hemisphere, would, as you can see, lead to Broca's aphasia. In that, you do have a defect in fluency of speech, as you can see there, non-fluent speech. Patients also have poor repetition, but they can understand what's being said and what's being told to them. So they have good comprehension. So this diagram is helpful in kind of trying to break up all the different types of aphasia. And hopefully kind of walking through this helped answer this answer choice for you guys today.
Excellent. Thank you, Paras. Great job, everybody. 42% of you guys got it right. If you didn't, don't worry. You'll get it right on test day. This is a topic that can give students some trouble, but well done overall. So let's move on now to our second question of the evening. Once again, you will see that the answer choices are covered up, and we will begin with the lead-in. What is the most likely cause of his symptoms? What is the most likely cause of his symptoms? I will give all of you a few seconds here to respond and let us know how many steps you think this question will require. And then we will move on and read the vignette. Normally in our coaching sessions, our coaches will stop you after every sentence, ask you what you're thinking, what are the most important parts of that sentence, what's on your list of differentials. And this helps us identify your thought process, identify your strengths and weaknesses, and really figure out why you're missing questions if you're missing them by identifying those patterns. So keep that in mind as we discuss coach here in just a little bit. So with that, let's go ahead and read the vignette. A 50-year-old man comes to his primary care provider because of difficulty grasping objects. He has also noticed worsening depth perception during the past 3 to 4 months. He is concerned because a distant relative, his mother's cousin, has Parkinson's disease. He has a 30-pack year history of cigarette smoking, but quit 4 years ago. He reports drinking 2 to 3 beers per day during the work week, and as many as 6 per day on weekends. On physical examination, he is afebrile and appears anxious. There is a coarse tremor that seems to worsen toward the end of some hand movements, such as when the patient is asked to pick up a pen. He also has difficulty when asked to rapidly alternate tapping the palm of one hand with the finger of another. No nystagmus is noted on ocular examination. Gait and station are normal. What is the most likely cause of his symptoms? I will give all of you a few seconds to start thinking about what the most important keywords are in that vignette as I hand it off to Paras.
Thank you, Sean. So once again, we'll kind of talk you through what we think are the important clues in the vignette and the lead-in. So again, demographics, 50-year-old man. That will always help you in narrowing down a little bit what disease or pathology might be going on. Now we know he has some kind of neuro issue, grasping objects and depth perception. They gave us some social history. And you know, in neuro, and especially when you get to clinical rotations, you'll find that the neurophysical exam is very, very helpful in helping to localize lesions and localize what part of the CNS or PNS is really at play. And that's kind of the same thing here on physical exam. They give us some very important physical exam findings. And that's going to be, along with everything else, helpful here. So we talked about, you know, the tremor. We talked about difficulty rapidly alternating his palm, tapping it, and then, you know, whether he had nystagmus, whether he had a normal gait. So then we get to the lead-in. What's the most likely cause of his symptoms? Well, I think this is, you know, kind of depends a little bit on the answer choices. I think this could be a one-step question if they're, you know, just giving us a disease state, or maybe they're getting at pathophysiology. Maybe this is like a pathophys question. So then, you know, one, we need to know what is disease or disease process is, and then two, we need to know what's happening at a pathophysiologic level. So this could be a two-step question. So let's take a look at those answer choices and see what they're kind of playing at. So right now we have some answer choices, have an idea of what they're kind of getting at. So answer choice E, Wernicke encephalopathy. And again, we'll start at the bottom and work our way up. Answer choice E, Wernicke encephalopathy. D, degeneration of the vestibulocerebellum. C, degeneration of the spinocerebellum. B, degeneration of the cerebrocerebellum. And A, alcohol intoxication. So once again, we'll go ahead and open up that answer choice, the poll. Go ahead and select the answer choice that you think is the most correct answer, and we'll talk about it in just a few seconds.
Excellent, thank you, Paras. So we'll give all of you a few more seconds here to respond. I know it's a challenging question. And then we'll briefly talk about RX Coach. And if you remember the diagram that we looked at earlier of the anatomy of the brain, I'm going to show you something really interesting later on today, a new feature in RX Bricks that actually allows you to quiz yourself on those anatomical areas via interactive images. I think you guys will really enjoy that. All right, I see the answer choices coming in. Pretty even split so far. We'll give all of you a few more seconds, and then we'll go over the correct and incorrect answer choices. All right, well, let's take a look and see what you selected. 30% of you selected degeneration of the cerebrocerebellum, and 22% of you selected degeneration of the spinocerebellum. So let's take a look and see what the correct answer is. And the correct answer is B, and 30% of you got it right. So congratulations to those of you who did. To those of you who didn't, don't worry. Boris is going to explain it to you now.
Thank you, Sean, and great job, guys. Definitely a tough question. So let's talk about this. So we know that this patient has some issues primarily with motor coordination. So grasping objects, rapidly alternating the tapping of one palm with the finger of another, and also has a hand tremor that specifically is noticeable at the end of certain movements. So this is getting, as the answer choice, correct answer choice is telling you, at the cerebrocerebellum or the neocerebellum. And this rests in the lateral cerebellar hemispheres. It is responsible for fine movements of the hands and face, motor planning, and complex task coordination. So if you were to have a lesion in the cerebrocerebellum, you would have symptoms on the ipsilateral side of the body. And certain physical exam findings include, and you may have heard of this, dysdiadokinesis, which is that physical exam test where you rapidly alternate hand movements as described in the vignette, and then an intention tremor, so which is a tremor that worsens with intent of something. So this is common in cerebellar disease. So those physical exam findings should automatically point you to a cerebellar issue, okay? Other symptoms that can be represented include dysmetria. So you'll see patients touch their finger and then try to touch the touch their nose and then try to touch the examiner's finger back to their nose, and vice versa. So this is getting at cerebrocerebellar degeneration, but let's talk about why the other answer choices are incorrect in case you're wondering that as well. So Wernicke's encephalopathy. So we usually see this in alcoholics who have thiamine deficiency. And patients usually have a classic triad of symptoms: ophthalmoplegia or nystagmus, ataxia, and encephalopathy. Now, they didn't tell us this patient has confusion, and they said that the gait is normal, and there's nothing about eye issues. No nystagmus is noted. So that answer choice E is very unlikely. Answer choice D, vestibulocerebellum. So this is responsible for rapid eye movements, posture, and balance. Again, none of which are abnormal in the patient. They said there is no nystagmus, and the gait and station are normal. So unlikely to be D. C, spinocerebellum. This is a midline structure that incorporates the anterior vermis of the cerebellum. And hopefully that phrase anterior vermis rings a bell with you guys. It is the area that's most damaged with chronic alcohol abuse. Now with that, patients chronically or classically present with truncal ataxia or a wide-based gait. However, in this question, they told us that gait was normal. So although this patient is drinking, it's unlikely that they have anterior vermis degeneration because they do not have an abnormal gait. And then lastly, alcohol intoxication. So acute alcohol intoxication can actually present with many of the same symptoms as this patient, but they would relapse and remit according to the drinking habits. This patient has progressive worsening of symptoms, and furthermore, the intention tremor is not something you would see with acute alcohol intoxication. So that's unlikely to be answer choice A. And the best answer here is answer choice B, So one of the key takeaway points is knowing the different structures of the cerebellum and specifically what are they involved with in regards to the body movements.
Excellent, thank you, Paras. You can also go here in First Aid 2020, which is page 511, to see more about this topic. Now, before we continue, I want to ask all of you a question. And the question is simple, is how would you describe the results you are seeing after your study sessions? I am seeing great results and I am happy. The results do not match my efforts. I'm plateauing, or I'm spending too much time and falling behind. Keep in mind that these answer choices are completely anonymous, but please be as honest as possible. This is important for us to know. We'll give all of you a few seconds here. And we'll wait until about 2/3 of you have responded. Only a quarter of you have responded so far. And then we'll move on. All right, a few more seconds here. All right, about half of you. We'll give all of you a few more seconds. All right, well, let's go ahead and take a look and see what you selected. So about a quarter of you are happy and you're seeing great results. But a majority of you are either seeing results that don't match your efforts or plateauing, or you're spending too much time and falling behind. And for those of you in that category, or even in the first category, even if you're happy with your results and you want to get a higher score, or especially if your results aren't matching your efforts, or if you're plateauing, or if you're falling behind, reach out to RX Coach. You know, we know that it's an investment, but that investment has given great return for all of our students who have succeeded and gotten the scores that they want. Now, medical school is also expensive, right? And so doing the best we can on this exam is the best thing we can do to set up ourselves for success with residencies and MASH programs down the road. The way RX Coach works is we have highly trained RX certified tutors like Boris and Alec, who you met today. We start you off with a 160 question assessment, and we've created our own assessment, and we've authored all of these resources so we can take a data-driven approach to pinpoint your strengths and weaknesses. We work with you to see what your strengths and weaknesses are, help you create a study plan so you can study efficiently, because we have a lot of students who spend a lot of time studying, but they don't see the results they want, and that is simply because they may not be studying the right way, or they may be studying the right thing at the wrong time or in the wrong order. And then we work with you also to make sure that you are able to apply what you have learned and have good test taking skills to succeed on test day. So we work on knowledge and content, we work on test taking skills, we work on timing, and we work on stamina. So if you're interested in being one of our success stories, please visit us online at rx-coach.com. Click that free consultation tab so that you and I can talk about the program and how it can benefit you. It is, like I said, an individualized program, unlike a USMLE test prep course, where we work with you one-on-one to ensure that you're doing everything the right way to get the score that you have always dreamed of and become the physician that you want to become. So once again, that website is rx-coach.com. Click on that free consultation tab, and we can have a discussion about the program and how it can help you. We have some special offers going on right now with the holidays, and I'm happy to go over them with you during our chat. All right, so with that, let's go ahead and move on to our third question of the evening. Which of the following abnormalities is most likely in this patient? So we'll read that lead in one more time. Which of the following abnormalities is most likely in this patient? I'll give all of you a few seconds here to respond and let us know how many steps you think this question will require. I see the responses coming in. Let's go ahead and read that vignette. A 5-year-old boy is brought to the clinic by his mother due to excessive vomiting and sweating. His symptoms began soon after his mother found him eating wild mushrooms. The patient is afebrile. Blood pressure is 80/45. Pulse is 58. And respiratory rate is 16. On physical examination, the patient is abnormally drowsy, sweating heavily, and salivating. Which of the following abnormalities is most likely in this patient? As all of you start thinking about the relevant clues, I will turn it over to Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So as always, demographics. So we know this is a pediatric case, 5-year-old boy. And why is he being brought in? Well, excessive vomiting and sweating. A lot of times we forget why they came to the clinic in the first place. What was that chief complaint? And when you start to write your SOAP notes in clinic, that's often the first line of your notes, so don't forget that. Most importantly, we found that his symptoms began soon after he was eating wild mushrooms. Furthermore, and I would also highlight this, it may not have appeared on the slide, but you know, he does have a blood pressure of 80/45, a pulse of 58, and he's drowsy, sweating heavily, and salivating. So I would also say those are important as well. So we know some few things about his vital signs, physical exam. Great. Now they're asking us, what abnormality is most likely in this patient? Well, you may think that's a weird way to word a question. So what are they getting at? So I think they're probably getting at a two-step question here. I think one, we need to figure out what is the diagnosis in this question. Two, what abnormality may we also see in this patient? So I think a lot of times when a question's worded that way, that's something that they're getting at. What else are you going to see in this patient? So let's take a look at those answer choices and see if that's what they're getting at. So as you can see here, the answer choices, and again, we'll start at the bottom and work our way up. So which of the following abnormalities would you most likely see in this patient? Answer choice E, vasodilation. D, urinary retention. C, mydriasis. B, lipolysis. And A, decreased GI or gastrointestinal motility. So we'll go ahead and open up that poll. Go ahead and select the one that you think you would most likely see in this patient as well, and then we'll talk about it in just a few seconds.
Excellent, thank you, Boris. I see a lot of people in the question box, you know, rushing to answers. Remember, we're not competing with each other now. You're not competing with anybody else on test day other than yourself. So you would be well served to take some pause and have an organized thought process and not jump to anything, but follow the steps that we've outlined today to ensure that you're getting to the right question in a timely manner, okay? So just some advice for all of you out there as you are all studying, doing practice questions, and of course, taking the test on test day. We'll give all of you a few more seconds here. It's a tough question, but it seems like most of you are on the right track. All right, a few more seconds here, and then we will go ahead and go over the correct and incorrect answer choices. All right, and let's take a look and see what you selected. And it looks like 48% of you selected vasodilation and 26% of you selected mydriasis. So let's take a look and see what the correct answer is. And the correct answer is E, vasodilation, and 48% of you got that correct. So well done to those of you who got it right. For those of you who didn't, don't worry. Boris is going to explain it to you now.
Thank you, Sean. Great job, guys. So great job in picking up what else would be seen in this patient. So this patient's presenting with diaphoresis, vomiting, somnolence, bradycardia as well with a low pulse, and hypotension with a low blood pressure. Specifically after eating wild mushrooms. So this is suggesting muscarinic toxicity. So we are thinking that this patient has muscarinic toxicity. So what else could we see in this patient? Well, on the next slide, Sean has actually included a table that you can find in first aid that shows what are some of the different effects within the body based on the type of M receptor, okay? So specifically, in this case, an M3 receptor. So increased exocrine gland secretions, increased gut peristalsis. So remember, answer choice A was decreased GI motility, so we can now say that that's incorrect. Increased bladder contraction. So that's, again, the opposite of answer choice D, which was urinary retention. You can also see that activation of this M3 receptor will cause meiosis, which is opposite of the answer choice of mydriasis. And lastly, the very end of that comment, you can see endothelium-mediated vasodilation. So activation of M3 receptors on endothelial cells leads to vasodilation, as a lot of you selected. Lipolysis is kind of a red herring. That has more to do with sympathetic activation. But the other answer choices, decreased GI motility, mydriasis, and urinary retention, are the opposite of what you would see with muscarinic toxicity. And so the correct answer here would be vasodilation, as you guys selected.
Excellent. Thank you, Paris, for another wonderful explanation. Let's go ahead and get into our last question of the evening, and hopefully we can finish strong. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following neurotransmitters is most likely used by these large integrating neurons? Which of the following neurotransmitters is most likely used by these large integrating neurons? I'll give all of you a few seconds to respond in the question box and let us know how many steps you think this will require. And then we will read the vignette together. All right, I see the responses starting to come in. Let's go ahead and read that vignette. A group of researchers is studying integration of brain muscle control in normal subjects. They use normal human tissue recovered from brain operations done to remove neoplastic tissue. The image shown is a photomicrograph depicting normal cerebellum tissue recovered from such a procedure. The large cells in the image integrate the cerebellar cortical activity and transmit that information to the deep cerebellar nuclei. Which of the following neurotransmitters is most likely used by these large integrating neurons? As all of you start thinking about the important clues, I will hand it off to Paris.
Thank you, Sean. So once again, we'll go ahead and tell you what we think are the important clues in the vignette and the lead-in. So, they give you something about an experiment here, and that's great. But, at the gist of this question, the experiment itself or the study is not super important. It's more so what is in that image and what do we need to know about that image and what do those potentially cells do. So they tell us that that's cerebellar tissue, and it's talking about those large cells transmitting information. And that's essentially, when you read that lead-in question, you can already get a sense of what you need to pick up on in that vignette. So the lead-in said, what is a neurotransmitter used by these large integrating neurons? And you can already just take a look at that image and see that, okay, I just need to figure out what these large neurons are. And that way you know what to highlight and what's important in that vignette. So that's one of the additional clues of, additional helpful things about reading that lead-in first. So in this, how many steps do we think this is? Well, I think this is probably a two-step question. I think one, we need to know what those large integrating neurons are, and then two, what neurotransmitter does it use? So maybe a nice two-step question here. So let's take a look at those answer choices. And once again, we'll start at the bottom and work our way up. E, glycine, D, glutamate, C, dopamine, B, acetylcholine, and A, gamma aminobutyric acid or GABA. And once again, we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is the right answer, and we'll talk about it in just a few seconds.
Excellent, and this is our last question of the evening, so hopefully we can finish strong. We'll give all of you a few seconds here to respond, and we will go over the correct and incorrect answer choices. And of course, we will do our raffle and special offer, and one of you will win a very valuable prize, so make sure you stick around because you must be present to win. Responses are coming in. We'll give all of you some more time. I think we're a little ahead of schedule today. All right, just a few more seconds here. And let's take a look and see what you selected. And it looks like 37% of you selected answer choice A, 26% of you selected answer choice B. Let's see what the correct answer is. And the correct answer is A, and 37% of you got it right. So let's hand it off to Paras so he can give us one of his wonderful explanations again. Paras.
Thank you, Sean. Great job, guys. Another tough question here. A little bit of a histology mix as well. So the question shows those cells, right? And this is normal cerebellum, and it's asking about those large cells that transmit activity to the deeper cerebellar nuclei. So this is really getting into the physiology, not just of neuro, but specifically cerebellar physiology, which I know we all love. So the cells in question are actually Purkinje cells. Now, it's important to know that Purkinje cells are inhibitory cells in the cerebellum. So they primarily release GABA, which is an inhibitory neurotransmitter. So one, we need to know that these cells are Purkinje cells. Two, we need to know that Purkinje cells are inhibitory cells, but then we also need to know which transmitters are inhibitory versus excitatory. So a little bit of basic pharmacology, a little bit of basic physiology, but also neurophysiology as well. So hopefully you guys are starting to pick up on why it's important to keep these things fresh in your memory, because they're utilized across a lot of different organ systems and topics. So as we discussed, these Purkinje cells primarily release GABA onto the neurons of the deep cerebellar nuclei. Acetylcholine and glutamate are actually excitatory neurotransmitters, so those are kind of out of the question. Dopamine can be either excitatory or depending on the subtype of receptors, but it's not used by Purkinje Purkinje cells. Glycine is the only other primary inhibitory neurotransmitter of those answer choices, but it's not used by Purkinje cells, so that would be an incorrect answer choice. And actually on the next slide, Sean has pulled up a table looking specifically at the cerebellum. And you can see in the output, in the bottom half of that column, Purkinje cells, always inhibitory, and always inhibitory to the deep nuclei of the cerebellum. So it's important to keep all these different nuclei and cell types in mind. And another takeaway from this question is that as we've gone into 2020 and beyond, a lot of questions now are becoming much more multimedia focused. So images, radiography. So keep that in mind. Make sure to use your first aid, your bricks, your flashcards to be studying these images and make sure that you know what they look like on multimedia as well. Back to you, Sean.
Excellent. Thank you so much, Boris, for the wonderful explanations this evening. Let's go ahead and take a look at this new feature I mentioned earlier. So as you can see, I pulled up our brick here. And for those of you who haven't taken a look at bricks, Jeff will talk briefly later about how you can access over 150 free bricks, okay? So this brick here is on cerebellum structure and function. One of our more challenging questions from this evening came from this topic. We have our learning objectives laid out here of what you will be able to do after completing the section, and a case connection, which we will get to at the end. We have simple questions here like, what is a cerebellum? And then we explain it to you, but look at this interactive picture with this quiz. You can hit that quiz button and these labels go away so you can see what they are and quiz yourself. And there are 4 such images like this in this particular brick, which makes it nice and interactive. You have clinical correlations as well, flashcards to help you quiz yourself along the way, another interactive image, mnemonics to help you remember the material and commit it to memory. And as you continue in this learning module, you will learn the material, and then you will get to the case connection again, tying things back to the beginning, and then a summary of the key points that you should have learned after studying this module. And you can practice with practice questions, and once you get the answer right, you will see the explanation. And here's another in training exercise here for you. You can review your learning objectives and mark off what you feel like you are confident with. And then if you want to stay organized and go deeper, you can go directly into first aid. You can study with flashbacks, you can watch express videos, or you can practice with questions in QMAX. So for those of you who haven't taken a look at bricks, I highly recommend you take a look at them. You know, we've had a lot of great feedback on this, and I think all of you can hopefully now see why.